Now, this is a super busy slide, but we're going to break it down so it doesn't seem too overwhelming. So, just from sort of when we think about sort of hormones and what happens sort of when we eat and for appetite stimulation, appetite suppression, and satiation. So, there are several hormones that come from the stomach, the small bowel, the colon, the pancreas, and even fat cells. And these hormones sort of stimulate a part of your brain called the hypothalamus. And that's where you have two different sort of pathways. One pathway will stimulate sort of a reduced appetite, and one pathway will stimulate appetite, right? And so, throughout all of these different hormones that are coming, you only have one hormone that is one that stimulates appetite, and that's ghrelin. And ghrelin comes from the stomach. And so that is a hormone, and all the rest of them are working in concert to help with reducing sort of appetite. And so that's sort of a thing that I talk to patients about big time when we talk about sort of things that sort of change ghrelin, change insulin, change leptin. And one of the things that we know happens with weight loss, if whether that weight loss is from diet and exercise, pharmacologic therapy, or from bariatric surgery, we know that with weight loss, you may notice that you feel hungry and people think that they are, their minds is playing tricks on them or, it's all their fault. But what we notice is ghrelin levels increase after you lose weight. So it's sort of a mean trick, right? Where you notice that I'm doing all this work, I've reduced my, caloric intake, I've gotten to this particular goal, I'm trying to get to my next goal, but now I'm more hungry. And that sort of is defeating for a lot of people and very frustrating. And so what we know is ghrelin levels increase. And so that's one of the things that we notice. Leptin is another hormone that is sort of protective that comes from fat, but we know that when there's too much, when there's excess fat, that you can get sort of a leptin resistance. We can also see that in one of the genetic diseases as well that causes patients to have abnormal or excess weight. So there's a lot of things that we notice that are should be protective, but when there's too much on it, there becomes a resistance of it. So this aside is really just to show that it's again beyond just how much you're intaking and how much you're moving. These are actually hormonal responses that are happening from several different organs that are affecting the arcuate nucleus in your brain to create sort of those responses that either help you to be satiated or to feel hungry. And so, taking it beyond the pathophysiology, we also think about sort of the many, many other sort of contributors. And so, we look at things like genetics, which we'll talk a little bit about later, epigenetics. And what we mean by epigenetics are other factors that sort of, if you have a particular genetic makeup, it doesn't necessarily mean that you will express that gene, right? You have to have something to manipulate it to make you express that gene. So, it's like having a key to a lock, but you have to actually put the key in the lock and turn it to open the door. And that's what we mean by epigenetics. There's a lot of other things like food marketing. There's no coincidence that you've seen all of these commercials, and now you're in your car, you're passing by somewhere, and you go, I have a sort of an urge to have X. Well, that's because there have been some signaling that you haven't even paid attention to earlier in that day that it sort of made you decide, oh, I think I need to have Starbucks or I need to have some fast food thing. Also, microbiome that we talked about earlier. Several changes in the microbiome from different hits, whether it was you're raised in the country versus the city, whether you had a dog growing up, whether you had siblings, whether you played outside, whether your mom was around you and made you wash your hands all the time, or whether you just played in the dirt. Whether you were born via C-section or vaginally, whether you were breastfed versus bottle fed, whether you were in the hospital a lot with a bunch of antibiotics, if you've had a cancer, had chemo, there's so many different things that change your microbiome. And so this is another factor. Sleep is also a big factor. So one of the things that we really harp on here too is to make sure people are sleeping. So studies have shown us that patients that get between 7 to 9 hours of sleep every night are sort of in that sweet spot. So we know patients that sort of work overnight, sort of our shift workers, our nurses that work overnight, these are patients that usually will have some difficulty with some weight. So trying to get patients to, not sleep too little or not sleep too much. And then behavior and habits. So we pick up habits sort of throughout our lives. And some things I tell my patients that you don't think about are being told kind of throughout your life to finish your food, finish your plate, don't leave food on your plate. So these are habits that sort of become sort of ingrained in your life as you are an adult. You continue to do that same thing. So you don't listen to that trigger that has come from your brain to tell you you're satiated. You continue the behavior pattern that you were taught, which was finishing your plate. Also, the reduced physical activity is a sort of a function of our world now, right? We don't have to go out and sort of actually physically get food. You're not sort of walking to work. We have these conveniences, but it sort of led to us having reduced physical activity. And then we'll talk a little bit about drug induced a little bit later. And that's when sort of some medications that we may be on, a big one I think of is I had a patient recently on prednisone, a steroid, which is a medication that can really sort of increase hunger and increase inflammation. Well, not inflammation, increase sort of that hunger drive, cause some insomnia, and can make people sort of just more hungry overall. There's cultural changes. So some patients will say, this is just what we eat. We eat a lot of pasta. We eat a lot of pork. This is sort of a cultural thing for us. Then we think about endocrine disorders. So patients with PCOS, for example, is one that comes to mind. These are things that sort of affect your hormone level. Energy homeostasis disruptions. So seeing sort of that increased sort of fatigue and brain fog and not wanting to move a whole lot. We think about prenatal exposure. So what is happening in utero? So that is also causing like effect on that unborn child, right? And then chemical exposures, a lot of those chemicals are sort of depending on where you live in a city, some of the foods that we're eating, and then stressors. That's the one big thing that my patients love to ignore. And it's sort of the amount of stress that we are under, sort of day in and day out. Stress was an evolutionary response to sort of help get you away from a problem. But now this is sort of chronic, whether it's from traffic in the morning, waking up early for a commute, rushing to get kids ready for school, being in a pandemic. Let's see, dealing with particular coworkers that may be challenging, having a big talk that you have to do. These are all things that cause sort of chronic amounts of stress, which we don't recognize, sort of contribute to sort of snacking and emotional eating at times too. So all of this information we have, what on earth do we do about it now? And so one of the things we like to look at is acknowledging and sort of stepping back and getting rid of some of that bias and recognizing obesity as a disease. And then collecting all of that data of everything we just talked about. It's a lot of data collection to sort of see where we are and where we're going to start. Doing that evaluation and assessment. So I'm able to figure out that family history, those medications, sort of how did you grow up? What is those cultural restraints? What are those barriers that you may have? What are your decision-making skills? Sort of how do you think about food throughout the day? Do you pack your food? Do you grocery shop? Do you have a particular place to eat, or do you eat sort of en route on the car? And then that motivational sort of interviewing where we talk about these interventions, the physical activity, the behavioral therapy, the pharmacologic therapy, and those procedures as well. So it's a lot that goes into something that people, used to just sort of poo-poo off and say, nope, it's all your fault. And so the goal is sort of to be able to use all of these things the same way we would do any other disease, any disease. If you had high blood pressure, diabetes, or fatty liver disease, these are all things I'm going to talk about with my patients to sort of get you to a point to get you over those disease processes. And so I like to think of it of sort of a multi-pronged approach. It's not just one thing, and not everything will work for everyone. So once somebody sort of is characterized or has a diagnosis of overweight or obesity, we start to think about lifestyle changes. We start talking to them about sort of what is happening in their life, what contributing to those factors, and sort of how we can sort of create some changes that work within their lives. We also will think about adding on pharmacologic therapy, in which these are all things we're going to talk about, bariatric endoscopy, and then bariatric surgery as well. And so when I start with nutrition, I like to give patients information. When patients have more information, it's sort of just being able to know a little bit more. Once you know a little bit more, it's easier for you to sort of put those things into action. And so I try to change patients' expectations about living and what it means to age. And so I think in this country, a lot of us think that as you get older is inevitable. Of course, I'll have high blood pressure, high cholesterol, and diabetes. I'm getting older. That's normal, right? And my goal is to get people to think that no, that doesn't have to be your normal. Let's change that narrative. Let's change how we view aging in this country. And so I take a lot of those kind of thoughts and ideas from these blue zone populations. And blue zone populations are the highest concentration of patients that live to be age 100 or older around the world with reduced sort of morbidity and mortality. And some of the things that we see that are very different in sort of the way they live life versus us in the US are dietary. So a lot of those are sort of increased fruits in servings of fruit per day, increased servings of whole grains per day, and vegetables, and then reduced amounts of meat every day, right? And so in the US, it's multiple meets throughout the day. In these blue zone populations, you may get 3 to 4 meets per month. And so getting patients to sort of see those differences and shifts and sort of how there are changes that sort of can really contribute to how you live your life. Other things are sort of these patients being able to sort of spend time with their families. And so there are also usually some type of meditative practice as well. So it's a lot of sort of bonding and joy and love and sort of activity and movement. And so getting us in sort of in our population to add those things back in, to be able to slow down a bit and to think about what those gains will be down the line, and sort of trying to prevent patients from having to spend all their time going to doctor's appointments when they get older. Instead, I want patients to be able to think about, oh, I would like to be able to continue to go out to dinner with my family, to be able to go to my grandkids' graduations and travel, to be able to enjoy life as we age rather than sort of spending that time in chronic pain or in chronic discomfort. And these blue zone populations give us a blueprint and show us this can be done with sort of adding in those things in which we're slowed down, in which we're sleeping, in which we're eating whole foods and reducing those processed foods, in which we're getting more sort of meditative and sort of more purpose in life as well. So these are things I like to think about with my patients.